Let's go to visual diagnosis, inspection. The topic is swollen tongue body. It is necessary to distinguish between a tongue that is completely swollen and a tongue where only certain areas are swollen. A swollen tongue will be the result of too much fluid accumulating in the tongue, that is, dampness, phlegm, or accumulation of fluids, which is the opposite of the previous situation where the tongue was too thin due to lack of fluids. The accumulation of dampness, phlegm, or fluids in the body is in itself an excess condition. Um, Excess conditions will often, though not always, have the root in a deficiency condition. Heat, for example, can force fluids upwards the tongue or condense them so that they transform into phlegm. As with the color of the tongue, the swelling can encompass the entire tongue body or just be limited to a certain area that corresponds to specific organs or areas of the body. The size of the tongue body has to be related to the size of the head of the person. What might be swollen for someone may be normal for another, because the thickness of the tongue body depends on the supply of fluids and blood. A swollen tongue body indicates an accumulation of fluids, which may be dampness, phlegm, or edema. Thus, swelling of the tongue always indicates a full condition, particularly characterized by dampness or phlegm. Although dampness and phlegm usually arise from a Qi or Yang deficiency, the swelling of the tongue body reflects the full condition created by these two pathogenic factors. Although a total swelling of the tongue always indicates dampness or phlegm, a partial swelling may indicate other pathologies such as Qi deficiency, Qi stagnation, or heat. The areas where a partial swelling is most commonly seen are the sides in the liver or chest area, the tip, and the front third. A swelling on the sides in the liver area is very common and usually indicates liver heat. It is nearly always associated with a red color in the same area. A swelling on the sides in the chest or breast area generally indicates either retention of phlegm in the chest or breast or lung Qi deficiency. A swelling of the tip of the tongue, usually associated with the red color, is very common and indicates heart heat or heart fire deriving from severe emotional problems. A swelling of the front third of the tongue indicates retention of phlegm in the lungs. So you can see in this first one, there's swelling of the front third of the tongue, and on the second one is swelling of the front third of the tongue on the lung area. The swollen tongue. The tongue body is swollen, fills the mouth, and possibly even with difficulty in closing the mouth or retracting the tongue. It corresponds to stagnation of heat or poisoning. If the tongue is red crimson with swelling and pain, it is due to excessive heat of the heart and spleen, heat toxin obstructing upward. If the tongue is crimson purple with swelling, it is due to excessive drinking of alcohol and contracted worm disease, the heat pathogen combined with alcohol obstructing upward. Thank you for your attention.